So it's been 2 days after the surgery. I have the bandage off. They said it's good to take it off like 24 hours after the surgery so that you try to let it air out a bit. And then I was told to put Neosporin along the scar to keep it clean and just to help with healing. So I've been trying to do that about twice a day. My tongue still feels numb, like on the left side, and it kind of is affecting my sense of taste a little bit. So I really hope that goes away soon. That's kind of my biggest complaint, but there probably is a lot of worse things that could have gone wrong. So I just hope this gets better for me. And I haven't been sleeping the best because I had to get up like the middle of the night to take like pain meds. So I've kind of been taking like short naps here and there, getting a couple hours of sleep, and then I have a hard time like falling back to sleep. So that's the things I've been struggling with. Hello everyone! So you see my hair is kind of a mess right now, and that's because I was trying to clean myself, so I want to talk about that. I can't really take a shower. I'm not supposed to get the incision wet right now, so the most I can do is like a sponge bath, but washing my hair has been such a pain. So I tried to put like a cup over the area, and then I was trying to lean over the sink, and I combed all my hair to one side, and my mom helped me a bit. We were trying to like scrub just this side and keep this dry. So that's kind of why I look like some punk rock singer with my hair all brushed to one side. So I'm just trying to let it dry before I let it get anywhere near this area. So I'm pretty sure we did a good job, but that is just something that you have to deal with when you have surgery on your head, trying to like keep clean. So I thought I'd just talk about that real quick. And I'm feeling a little bit better. Yesterday I had some like blood I was like spitting up, and I think that just kind of is from the tube down my throat. It got better, and I finally got better sleep. So I was able to sleep all night through. And the past 2 nights I was trying to sleep in like a recliner because they said they were supposed to keep yourself propped up a bit. But last night I slept in my bed again, and I tried to like prop myself up, but I did a lot better. I slept better this time, and I just laid on my bed, my good side. So I'm feeling a little bit better, not as sleep deprived. So that has helped. And yeah, just keep recovering from there. Hi, so it's been like 5 days after the surgery, and I feel pretty good. I feel like I can walk around and do things for like a couple hours, but then sometimes I get like tired, or I'll get like a mild headache where I feel like a little bit of pressure in my head and I feel like I want to lay down, and that helps to relieve some of that pressure. So I think I'm just slowly getting back to normal, but I'm not like 100% yet. So I think it'll just get better with time, and I don't think it'll be like this forever. It's just I'm readapting to my normal life. Another thing that's kind of bugging me is I wear glasses, so my vision's not terrible, but things are noticeably more blurry because I haven't been really wearing glasses because I don't want to have like this part on my ear and causing like strain. So I haven't really been wearing them, but it's kind of bugging me because I want to be able to see. So sometimes I've been like trying to prop them up on my face like this and see better, but it's not working very well, and it's a little bit disorienting, so I probably shouldn't be doing that. Maybe I should be wearing contacts, but it's kind of, I don't feel like doing it type of thing, so I'm just kind of dealing with that until I can put my glasses back on, which I assume in a couple days I should. I just thought I should be careful and not add any strain to the scar while it's trying to heal. So that's what's been happening. Hi everyone, here is an update. It's been 11 days since the surgery, and I just went to see the surgeon again for a post-op to evaluate how I'm doing and to look at my ear. He looked inside the ear to check for infections. He looked along the outside. So far he says everything looks good. He actually removed some of the stitching along the outside of the ear. I was surprised that he did that. It didn't hurt or anything. And he said it might just be helped release some tension, because earlier I would move my neck around and it kind of felt tight, or it would just be sensitive, so it kind of feels a little better now, not as tight along my skin. So that's a little bit exciting that he was able to do that. And he says there's 2 more layers of stitching internally, so it should keep everything close together. So removing this extra layer shouldn't be a problem. It's also still a little bit bumpy along the edge of my ear, but he said it should get better with time. It just, the swelling needs to die down. And I can feel the actual, well, the more like boxy part, I can feel it along here, and he says that should get flatter with time. It's just kind of swollen. So they actually recessed part of my bone so that it could fit inside there. So in time, I think it will just fall into place. It'll stay perfectly flat and it won't even really be noticeable, but it's just swollen right now. So I also talked to the doctor and answered some of my questions. I asked him about showering normally. Before, I was just trying to wash my hair in the sink. That was a bit of a pain. He said at this point it's fine. It's okay to let the incision get wet. It's not in danger of causing any infection anymore. I asked him about having to put like Neosporin along the scar, and he said that's not necessary anymore. It was good that I was doing it right after the surgery though. I also asked about exercise, because for the past week I wasn't allowed to do strenuous exercise. So he said maybe wait until the 2-week mark, if not later, before you start like lifting weights or causing any like pressure in your head. So that's just something to be careful of. He said walking is fine. Something that I like to do is go on walks. I also asked him about what if I were to fall. And he said that it's not likely going to damage the technology, and it's good if I just wear a helmet if I'm trying to do like activities like skateboarding or skiing or things like that as a proactive tip. And he also mentioned like they give this technology to babies when they're just trying to learn how to walk, and they'll be falling all the time, and it's perfectly fine. So that gave me some like perspective. So that was good to hear. I also asked him about my tongue, because right after the surgery I was having some numbness just along the left side. So he said that was just because they're working right along all those nerve endings, and it could easily be bumped and agitated. And over the past couple of days it has been getting better. It doesn't feel as numb. My sense of taste is a little bit off, but I think it'll get better with more time. It just is a progressive process for that. And I'm thankful nothing else went wrong with terms of nerve damage. My face is still intact, which I'm so glad about. I also asked him about wearing glasses or hearing aids, because I want to wear my cross aid temporarily until I can get the outside processor, and he said it's fine at this point that I start wearing my glasses. It's not going to cause any more strain on the scar, so I'm going to start wearing them again. He also, when he removed the stitching, there was a suture line, which is a little string at the edge of my ear that he cut off, so that's not there anymore. I wasn't sure what was going to happen with that. So another thing I asked him about was that extra bone in my ear that my mom told me about. And he said, right when you're trying to get close to the cochlea, there's usually just a clear opening right there so that they can put the electrode wire inside the cochlea. But in my case, he said there was some extra bone or cartilage and they had to drill through that. to put the electrode inside my cochlea. So I just found that interesting. I'm glad that they were able to proceed anyways. Another thing I wanted to mention is that this technology is MRI safe, the internal part. Before, that used to be a concern because there's a magnet inside the cochlear implant that could have caused problems with MRIs because they are also magnets and they could conflict with each other. So the newer technology has been designed so that they are MRI safe for at least like a certain level of MRIs. I forget how much, but it is very nice that this has been updated and improved. It makes it so much easier because before you would have to have it surgically removed before having an MRI, and that's a really big pain and risk in damaging the cochlea because you don't want that electrode wire being pulled out and put back in. Less is more in this type of case. And in terms of that, I also talked to him about the possibility of having to have another surgery later in my life. So he said he doesn't see it typically having to happen. He sees sometimes cochlear implants lasting 30 years, but there is that risk of technology breaking. It happens with anything, or always technology has an end of its life. So there is that possibility that at some point in my life I might have to have it surgically removed and have a new one put in. So when I talked to the Medell representative a little bit ago, and she told me that they design their electrodes to be as flexible as possible, and they do not curve the end of the electrode wire, and they said that they do this because they don't want it dragging along the cochlea when they try to take the electrode out. So this helps to preserve the cochlea as much as possible. So I found that really nice that they thought about this ahead of time. And she said some of the competitors do curve the end of the electrode so that there is that possible risk of damaging the cochlea. So I'm not an expert on this, but this is what I generally understand to be the case. So I also talked to the doctor about going back to work. He gave me a letter that I can give to my work saying I can return to work full duty. So I faxed that to them, so I plan to go back tomorrow. And now I'm just gonna continue my life as normal until October, when I can get the outside processor and they will do an activation day, and I will start this whole process of training myself how to hear. So that's exciting, and I will keep everybody informed and updated on how that's going. Hi again, it's been 3 weeks since the surgery and I'm feeling really good. Everything feels back to normal. I hardly notice that the implant's even there anymore, which is super nice, that it's just become a part of me, it kind of feels like. So I can still feel it, like if I'm putting my hand directly against my head, but when I'm just walking around or doing my everyday tasks, it's not noticeable, and I think it will get flatter. It just needs more time, just bulging a little bit, but nobody would know unless you were actually running your hand along my head. Also, my tongue is much better. My sense of taste is greatly improved, and it's not as noticeable that I had numbness. It's hard to believe that it's come so far so quickly, so I am very happy about that. And the scar has gotten better. It's less bumpy, a little rough, I guess, but it feels more normal, or it doesn't look as noticeable, in my opinion at least. I'm not sure what other people think, and it's hardly noticeable because I have longer hair. It's just covering up, and who actually looks directly behind your ear? That never happens. So it's not even noticeable at all. So if you're concerned about having scars with this surgery, don't worry, it's not really a big deal. Especially if you have long hair, nobody's gonna know. I also have been wearing my glasses again. It's not seeming to be much of a problem. It's holding them up perfectly fine. And I have my hearing aid on in there too. my cross aids for now. Because I haven't got the outside processor yet. So I'm glad that everything's going well. Also, my sense of balance, I haven't had any problems with that, and I've been able to work, I've been driving, been doing everything as normal and no problems, so that's a relief that I haven't had any issues with that. And the only other thing I forgot to mention, when I talked to the surgeon last week or so, I asked him why I was coughing up blood, and he said he didn't think it was actually from the tube down my throat. He thought it was from the surgery itself, and he said there might have been some blood that got caught in my inner ear, and then it just started to drain down my eustachian tube. So he said it wasn't a concern, and that's pretty typical. So I hope that's isn't too gory to talk about, but that's what happened, is as far as he can tell. So I think I've covered a good amount of everything that's happened in terms of recovery, and next week I'm supposed to see the audiologist, see the processor, and I'm really excited and nervous, and I don't know, I can't even imagine what it'll be like. So I'm just in suspense about the whole thing. I heard it may sound really high-pitched at first, but it'll get better, and it's practice, and I'm just going to try to stay as positive as possible about this and just keep working on it, and that's all I can really do. So we'll see how it goes. Thanks for watching.